what sort of people, what possesses adult people to take children on that sort of a journey and not check out carefully how the patient was doing afterwards and what it all meant? What sort of space do you have to be in if you are, you're talking about people who have prescribed very powerful drugs, you're talking about people who have done major operations. Surely you follow through. What sort of people don't think they have a responsibility to check through how their patients are doing afterwards?
So there's two bits to that. One is that in modern medicine, a lot of the time, you're going to get your care from several people because it's all become so specialised. And that's more true in gender medicine than in many things. So the people in the Tavistock never prescribe anything and never do any operations. All they do is refer. So they refer somebody to an endocrinologist, and there's a concept called the chain of trust in medicine, that all the specialists believe all the other specialists are doing their job properly. So if you're an endocrinologist and somebody comes in and they've got the piece of paper from the gender doctor saying this person has gender dysphoria, which is the fancy word for distress, give them testosterone or give them estrogen, you think they've done their job, and your job is just to check that they don't have some contraindication like, high blood pressure or diabetes or something. So you then give the child hormones, and then the child is referred on for surgery, perhaps at age 18. In this country, you can't get it below age 18. And that person thinks the chain of trust holds too, and they may remove that child's genitals or a woman's breasts or whatever because they think other people have done their job. But at the beginning of the chain, the person who says this child has gender dysphoria, they're not cutting anything off or giving any powerful drugs. They're not prescribing or operating. So I think it's that diffuse responsibility. If everybody's responsible, nobody's responsible. Like, nobody did the terrible thing, and yet the child ended up a sterile adult. And that's one part of the answer. But the other part of the answer is these people believed they were doing the right thing. Human beings are very prone to getting an idea in their head and thinking it's so right that it will be a waste of time to check. And the way you check in medicine is you have to do studies that have got control groups, like people you don't give the treatment to, and you compare the two. And doctors are dreadfully prone, historically speaking, to thinking, but I'm sure this is the right treatment, and if I withhold it from the control group, that's very unethical. And we train medical statisticians to understand that it's not unethical, and we give them lots and lots of examples of, in the past, treatments that got rolled out that people just assumed were the right thing, and they thought people looked like they were getting better afterwards, and then finally someone did a rigorous study. And it turns out that they weren't getting better, that it was the placebo effect, or just that this is the sort of thing you get better from over time. And in fact, they'd been harming their patients with this. So they haven't done that because they think they're right. And if I may just say one more thing about why they think they're right. So if we go back decades, it wasn't just little boys who turned up at clinics. In fact, they were just a tiny number of those who turned up at clinics. Clinics were basically for adults. It was adult men mostly, some women, but mostly men. And some of those men were gay men who had come to the conclusion that they were just meant to be women, that they were so womanly that they'd be happier if they were women. But some of them were heterosexual men who were fixated on the idea of being a woman for erotic reasons. So these are men who would be erotic cross-dressers, which is a fairly common minority sexual male interest, who had become fixated on it and wanted to live full-time as a woman. And for those men, like, convincing people that what they have is something serious and that must be helped. Like, I don't mock or dislike anybody because they have a fetish or an unusual sexual interest. I don't want to know about it, but I don't think they're bad people. But they feel shame, and a lot of people do shame them about it. So they need a narrative that isn't, I'm an erotic cross-dresser who can't just keep it to the bedroom at weekends anymore. And that narrative is, I was born this way. They got that narrative from the gay rights movement. And I mean, the fact is that a lot of gay people are born that way. We know that's a fact. But this is something different. And so if they're born that way, they need there to be children who are that way. And so those people are the main constituency originally for the idea that there are children who are born in the wrong body, or born actually being girls when they look like they're boys, or that sex can be assigned at birth. And they want that to be true because they want it to be true for themselves, and because that's the narrative they want to present to the world. I don't think it's that cynical, like I'm saying it like they're doing it deliberately. But I think it's a very, very deep-rooted psychological desire to be propped up by those children's stories. And that, to my mind, is how all of this got off the ground, that there are people who desperately want it to be true, clinicians who want to be saviours, and then a diffuse responsibility, which means that nobody takes responsibility. And, medical scandals are common. They happen really with repeated and tragic frequency. And when we look back at them, we always say, let's learn lessons. But when you look back, there'll be some particularities, like that story about adults wanting the children to be treated this way. But there are just also similarities. Doctors do get a saviour complex. Medicine is complex. People do palm off responsibility on each other. And then finally, people don't want to admit that they've got it wrong because it's too painful. Like, imagine you being the one who did those things. I do know a few of the whistleblower clinicians from the Tavistock, and they're people who practiced in this way before they realised that what they were doing was wrong, and they struggle mightily with it because they know they did some of their patients harm, and that's not what they went into their job for. So for some people who've gone further down that road, they can never admit it. It's too painful to realise what they have done and to admit it to themselves, so they will never change their minds.